10 minutes to your health.
So it's not a topic that's discussed much, but this morning we want to talk about what causes a coma, well, what is a coma, and how to treat and care for individuals who are in that state. With us via Zoom is General Practitioner and Chief Executive Officer of MB Link, Dr. Che Bowen. Morning, Dr. Bowen.
Hi,
Welcome to Smile
morning.
Jamaica.
Morning. Thanks for having me.
It's
How
our,
is everyone this morning?
we're fine, sir,
Good,
and it's our
thank
pleasure
you.
to have you, sir. What's the difference if you're unconscious as opposed to if you're in a coma?
Right, excellent question. The main difference is the duration. So again, a coma is a state of unconsciousness. The main difference is the length of time you're in that state of unconsciousness. And what does unconscious mean? It means you're more or less asleep. You're alive, but you're asleep. You can't be awakened or aroused by external stimuli. So they're closely related, but again, duration or length of time you spend in that unconscious state defines that you're in a coma.
Yeah. You said if you are unconscious, you can't wake up. Explain what you said again just now.
Right. If you're unconscious, you're not responsive to external stimuli. So if someone is shaking you,
Okay.
poking you, causing you pain, you're not going to be responsive to it,
Okay.
although you are alive.
Yeah. One of the things people say sometimes, Doc, is that people in a coma, talk to them, they can hear you, or read to them, they'll know you're here. Are brain activities happening when someone's in a coma?
Great question. Definitely, brain activities are still happening. They're not at the highest level, but they're still happening, and that's why the patient is in fact awake. So to answer your question, yes, speaking or hearing familiar voices, familiar stories, there is research that shows that this does help with the coma recovery.
Yeah. Even as a football coach, sometimes some of the youngsters would get hit, and I'm told by the medical people at the game that they were unconscious for a couple of minutes. I can understand that. What would cause someone to go into a coma?
Correct. So there are several causes, head trauma, as you indicated, being the most common cause. So most of the causes, again, are related to the head. So we're speaking about stroke. You may have a stroke, you may have head trauma, you may have bleeding, you may have infection in the brain even. Any sort of brain injury can lead to a stroke inevitably. Toxin overdose. So if you overdose on drugs, alcohol, if you have too much carbon dioxide inhaled, in the case of an asthma attack, again, this can lead to being put into a coma, a prolonged state of unconsciousness. And those are some of the main causes. So we're looking at, again, trauma, infection, and swelling of the brain even, a brain tumor where you may need to get surgical intervention. Those are, again, other causes of the coma. Diabetes is a top cause of coma. We're looking at your blood sugar either going too high or too low. So we have hyperglycemic comas and hypoglycemic comas. And of course, the hypoglycemic, when your blood sugar drops too low, that's the better coma, in that you can recover quickly from that as soon as you get your blood sugar back
Back
up.
up. Yeah. I've seen instances where people have said, we've had to put the patient in a coma so that we can address the problem or that they can heal faster. Why does that happen in some instances, Doc?
Right.
Like a
I
medically induced coma.
A medically induced coma, correct. So sometimes the wrong medication or too much of a certain medication can cause the patient to go into a coma. However, a coma is not usually induced on purpose.
Oh.
A coma is not usually induced on purpose?
Not induced on purpose, sorry.
Oh, well, I just learned something because I'm sure I would have heard or read where they would have deliberately, as they little said, put somebody in a coma because of some injury or something like that. That's not so?
No, that's not so.
Wow. How long can you stay in a coma? Because I don't know if it's just the movies or the books that I read that someone was in a coma for like 3 years and they woke up. How long can you stay in a coma? And if you are out of it, are you 100% or do you suffer because you were in a coma for so long?
Right. So the length of time you're in a coma depends on the cause. And if it's a serious cause like lack of oxygen to the brain, you can be in that coma for a very long time. I think the longest period of time someone was in a coma was 37 years. They went in for a simple surgery, was put under anesthesia, and they remained in that coma for 37 years at the age of 6. They did die in the coma. However, there are instances where long comas, patients do recover, come out of the coma. So that is in the case of up to 27 years. I think that is the record that patients have been in a coma and come out alive.
37, you said? 37 years?
37, correct.
Wow.
Wow.
Wow. How do you know, as a medical person, obviously, that I'm going to make it out? So I'm in a coma for 6 months and I've gone 7, 8 months. Can you tell that I'm going to make it out, or it's just a wait and see?
Right. It's very difficult to tell exactly when someone will make it out of the coma. So you're more or less giving them supplemental supportive care, monitoring their vitals every day, monitoring their recovery. So there are certain parameters you would look at, like eye movement, verbal movement, or movement of the body, which would gauge, and we kind of are able to gauge the day-to-day recovery from the coma. However, in terms of when the specific date will be when that patient will come out of the coma, it's really unpredictable.
Yep. You already mentioned the 37 years, but again, as a doctor, would there be a time that you would suggest that, no, this is not going to work? He's not going to make it out? Is there a time that you would say that?
Right. There is a time where we would suggest it, but it would come down to what the family wants for the patient.
But there is a time that you would suggest, or you would know that he or she probably won't make it out.
Correct.
Wow. How prevalent is this in Jamaica, Doc? Do we have a lot of folks that end up in a coma?
Especially from the trauma side of things. So head trauma, we have a lot of accidents in Jamaica, motor vehicle accidents, bike accidents. So yes, comas are relatively common in Jamaica, and we do have a decent recovery rate.
Wow. Wow.
Wow.
I didn't know that it was so much. So for loved ones who are watching, I mean, I know it can be a weird experience because of information or misinformation. I mean, I had some myself coming into this interview, Doc. What would you say be the best approach for family members or support teams when they get the call to say, listen, your loved one is in a coma?
Right. The best approach would be to more or less be there, be as supportive as possible. You want to still show up and be at the hospital speaking to the patient. Again, there is evidence that shows that, family support, family interaction, family voices, they help with the recovery of the patient from the coma. So, I mean, you want to remain optimistic. You want to speak with your doctor. Again, based on the cause, that will determine how quickly you can come out of the coma. So you will be able to gauge how serious of a condition it is just by speaking with your doctor. It is a medical emergency, and therefore it's something you want to, the quicker you get to treatment is the quicker or the more likely recovery would be.
Yeah. Final question, Doc. How do you, again, as a doctor, know whether he's just unconscious or he's in a coma? If someone comes to you, how can you tell whether it's more than just being unconscious?
Right. So again, duration plays a heavy role in that decision. If the patient is unconscious for longer than 2 or 3 hours, and we do our respective examinations, we check some verbal response, some eye movement response, some response to painful stimuli, and we gauge that and come up with the diagnosis that this patient is in a coma and is not going to be waking up anytime soon.
All right. Thank you so much for speaking with us this morning, Doctor. And thanks on behalf of all of us for what you do as a medical person. Thanks very much. Dr.
Thanks
Shea.
for having me.
Yeah, man, our pleasure. Dr. Shea Bowen, General Practitioner and Chief Executive Officer of MD Link.
Up next, the backwards word challenge. Neville and I are going to go shoulder to shoulder, head to head, nose to nose, foot to foot, elbow to elbow.
Whatever.
We'll soon come.
10 minutes to your health, folks. We'll do it again next Thursday.